The Beery VMI is an individually administered measure of visual motor integration, visual perception, and motor coordination. It is typically used with individuals ages 2 to 100 years old, and the patient is below average compared to same age peers. The patient was also assessed via clinical observation, caregiver interview, and report.
Hello everyone, my name is Victoria Valladares and I'm a certified occupational therapy assistant. I'm here alongside
Valentina.
And Valentina is how old?
8.
8 years old. Today Valentina is going to be completing the Beery VMI. This is a copy just for video purposes. However, we are going to score it at the ends of the exam. She's only going to complete today the part of Beery VMI, and that's all for today.
About the client, Valentina is an 8-year-old female and her interests are movies, makeup, and play. She does receive occupational therapy services and music therapy. The clinical observation was that the client was fidgeting prior to filming video, had constant outbursts, asked 10+ questions, and presented anxious when making mistakes. Child does present with age-appropriate grasp, demonstrates eye contact and correct posture throughout the evaluation. Okay, Valentina, so remember you cannot erase, okay?
No.
Okay. I know it's a little hard, but just try your best.
Okay, so now we're going to go ahead and score the Beery VMI. And again, for video purposes, we're only going to score this section of the VMI. So the client's name is Valentina. She is in 2nd grade. She is a female. The examiner is myself, Victoria Valladares, and the test date was on April 20th, 2024, and her birthday is April 10th, 2016. Her chronological age is 8 years old, 0 months, and 10 days. So her raw score was a 16. The standard score was an 82. The scaled score is a 6. Her percentile is 12. And she is indicating right now at the age range of 5 years old and 11 months. So the next exam that we're doing was the short sensory profile. The client's name is Valentina. The child was born on April 10, 2016, making her 8 years old and 10 days. The examiner's service provider is myself, Victoria Valladares. The profession is occupational therapy, and this is completed by her caregiver/mother, Vanessa Guanch.
So these are the recommendations that we provided to Valentina's caregiver. Valentina should definitely work on handwriting practice, since Valentina has difficulties with letter formation, line adherence, sizing and space. Focusing on handwriting practice can be beneficial. Occupational therapy can provide specific exercises and activities to improve her grasp, hand strength, and letter formation skills. She should also work on her fine motor skill development. Providing Valentina with activities that target fine motor skills can help her improve her dexterity and hand control. Activities like using tweezers to pick up small objects, manipulating putty or Play-Doh, and using scissors to cut shapes can enhance her fine motor skills ability.
As for sensitivity/sensor, she scored 39, indicating that she is much more than others. And as for registration/bystander, she scored a 21, right at much more than others.
These are the recommendations that we would recommend to Valentina's caregiver. Valentina must work on handwriting practice skills since Valentina has difficulties with letter formation, adherence, sizing, spacing, focusing on handwriting, and practice can be beneficial during occupational therapy and can provide specific exercises and activities to improve her grasp and her strength and her letter formation. We also would recommend fine motor skill development, in which providing Valentina with activities that target fine motor skills can help her improve her dexterity and her hand control. Activities like using tweezers or picking up small objects, manipulating putty or Play-Doh, and using scissors can cut shapes and enhance her fine motor skills abilities. These are some of the specific activities that I would work on Valentina in our treatment session. Beanbag tossing, which set up a target using a hula hoop or a bucket and have Valentina practice throwing beanbags into the target. This activity can improve her hand-eye coordination and fine motor skills. We could also grade up by increasing the distance between Valentina and the target, as well as engaging in Simon Says. This is a classic game that is great for improving motor planning and coordination. We can give simple commands such as Simon Says touch your nose or Simon Says hop on one foot, encouraging Valentina to follow the commands and imitate the movements during the instructions of the treatment session. For our short-term goals, this is the short-term goal that I would create. Valentina will write an age-appropriate sight word with appropriate letter formation and sizing with minimal assistance in 75% or more of attempts within 3 months. Valentina will also cut a 2-inch circle given minimal verbal cues in 4 out of 6 trials to develop and refine scissor skills within 3 months. It was recommended to Valentina's caregiver for her to attend OT visits 3 times a week for 60-minute sessions. Recommend for Valentina for her sensory integration to engage in sensory integration activities that could help Valentina improve her sensory processing skills, her attention span, such as activities like swinging, jumping on a trampoline, or playing with textured materials that can provide sensory input and help her regulate her sensory system. These are some of Valentina's difficulties. Valentina is behind than her peers developmentally. Valentina does not interact with her peers in an expected way during playgroups. Valentina needs support to catch up and improve her interactions with peers. Valentina has challenges with visual perceptual skills such as recognizing shapes, colors, and matching objects. Valentina struggles with visual motor integration, which affects her ability to coordinate her hands and movements with what she sees. Valentina also has difficulties with fine motor skills such as holding a pencil, using utensils, which can impact her ability to perform her precise task. All this information was gathered by our parent caregiver interview as well as clinical observation.